My name's Dr. Peter Groom. I'm a family doctor in the United Kingdom, and I'm grateful for the opportunity to explain to you why I choose to use Everycare for my patients' home social needs. I started work as a hospital doctor, and I've been working as a family doctor for some years, and I've seen two major changes in our society that have affected my patients and the way I look after them. Firstly, many women now work during the day and therefore do not have the time or the ability to look after their elderly relatives as they used to when I first became a family doctor. But also the number of elderly patients in the community and their needs has hugely increased, and that's why I'm grateful for the sort of care and support that Everycare can provide for me and for my patients. As a busy doctor, I want to be able to put them safely and quickly into the hands of a reliable care organisation, and Everycare, to me, fits the bill. I find that with one phone call, they will be quickly and reliably assessed and appropriate care given by the staff of Everycare, tailored to their individual needs. Patients again and again comment on the quality of that initial assessment, and then tell me about how well they are looked after in the community by the staff from Everycare. But most importantly, perhaps, in the overall picture, is that quality of care. Again and again, patients will volunteer to me information about the care that Everycare is providing. They might comment about the initial assessment and how thorough that was, how quickly it was provided, but also they will comment on the ongoing care and how professional and how all-encompassing that care is. But finally, and most importantly, I want to mention the impact of Everycare services on the medical care of a patient. From time to time, I will be called to a patient's home to problems that to me seem unnecessary and trivial, but they've been triggered by a frightened and lonely patient. However, with Everycare being involved, their professional judgment will quite often avoid me being called to problems that really can be looked after safely by the Everycare staff and the patient. Everycare and their professional care will also impact on hospital admissions. Quite often hospital admissions might have been needed for mostly social reasons. The patient just needed care, and being alone in the community, that care was not available. But now with the professional staff available from Everycare, I've found a lot of hospital admissions have been avoided. Accidental injury at home is always a problem to young and old, but particularly to the old. But again, with Everycare staff in the house, these sort of accidents are avoided, and the hospital admissions that they produce are avoided. And then, when an admission really is necessary, that patient is able to be discharged to their home far more quickly and far more readily and far more safely when Everycare are involved. And this all impacts on that patient's health, because thrombosis, constipation, malnutrition, bed sores are all the sorts of problems that can arise from prolonged hospital stays. So hospital stays are avoided and made shorter by the involvement of Everycare staff in that patient's needs.